Hi, my name is Damian Marucci. I'm a plastic and reconstructive surgeon in Sydney, Australia. One of the more common questions I get is how much does a breast reduction cost? So in this video, I just want to go through the different components of the cost of a breast reduction procedure. Breast reduction surgery, generally speaking, is not performed in the public hospital system in Australia. So therefore, by definition, it's done in the private hospital system. And the cost of a breast reduction varies between different surgeons and at different hospitals. Now, there is an item number for a breast reduction. And what that means is that part of the cost is going to be covered by Medicare and your health fund if you're in an appropriate fund. And generally speaking, there is less out-of-pocket expense if you have good private health insurance. Now, what I mean by good private health insurance is the insurance company will actually cover the item number of the procedure which you're intending to have. Some patients have a very low level of cover, which means that although they have private health insurance, when they go to make a claim for a particular procedure which they've had, their insurer will say to them, "I'm sorry, your cover is not adequate to cover that procedure." In terms of the cost breakdown for a breast reduction procedure, you can break it down into the costs of the hospital, the cost of the surgeon or the surgeon fee, the cost of the anaesthetist or the anaesthetist fee. So the anaesthetist is the doctor who monitors you while you're asleep and makes sure that basically you're kept alive and you go to sleep smoothly, you stay asleep for the whole procedure, and hopefully you wake up nice and safely at the end. So they're a very important component of a breast reduction procedure. The final cost relates to the pathology. Any tissue we remove as part of a breast reduction is sent off to the lab. They have a look at it under the microscope to make sure there's nothing exciting going on, no signs of breast cancer or anything like that. So going back to the hospital costs. So the hospital costs refer to the costs of actually being admitted, paying the clerical staff, the nursing staff, the use of the operating theatre, all of the sutures, the most basic dressings, looking after you in recovery, any medications you might be needing while you're in hospital. If you stay overnight, the cost of the hospital bed and all the nurses and other staff that look after you while you're an inpatient in the hospital. So these are generally covered by a health insurance fund as long as it's a good enough level of cover. In terms of the surgeon fee is partially covered by Medicare and partially covered by your health insurance if you have it, and then there is a gap, which is the difference between the actual fee charged and what Medicare and your insurance will pay. Similarly, for the anaesthetist fee, it's partially covered by Medicare, partially covered by the health insurance, and then there is a gap. In terms of pathology, it's different for different surgeons. With the pathology company that I use, they don't charge a gap for any of my patients, and it's all covered by Medicare and the health fund. However, that might be different with different surgeons at different hospitals. So the main takeaway points then is that if you are adequately insured, so you have private health insurance, which is of an adequate level, your out-of-pocket expenses basically are part of the surgeon fee, part of the anaesthetist fee, and perhaps part of the pathology bill. But patients who don't have any private health insurance, it's going to be the out-of-pocket expense is going to be a larger part of the surgeon fee, a larger part of the anaesthetist fee, a larger part of the pathology bill, but all of the hospital fee. So you need to pay basically for the cost of admission, the cost of being in the operating theatre, all of the consumables, the sutures, the dressings, and the cost for staying in hospital for however a longer period of time after the surgery you're in hospital. So uninsured patients can minimise the cost of having a breast reduction by either joining a health fund and waiting. The waiting period is usually between 6 months and 12 months. It depends on the fund. Or the other option is to have your surgery performed as day surgery. So then at least you're not paying for the overnight bed, which can run anywhere between $500 to $1,000. So that is certainly one other way of minimising the cost of breast reduction surgery. My name is Damian Marucci. Thank you very much for listening. I hope you've gotten something out of this YouTube video. Thank you.